So thank you to Matt Giovato for his documentation and updating of Dr. Bisanga FUE case. Not a massive FUE case in terms of numbers, but quite unique in terms that this patient had previous surgery elsewhere, looked very good, wanted to increase density in the crown, and of course we need to make sure that we can reproduce that nice swirl pattern for the crown, something that he actually picked up on and noticed at day 5 there was a nice swirl pattern in the crown, and came to us really due to our crown restoration, and then also looking for the temple point reconstruction, very subtle temple point reconstruction. This really needed us to be very careful on that extraction, getting those fine single hair grafts for the temple points, and also they are very flush to the skin. These are really the parts of bordering on now to the face. It's bordering onto the face more than the scalp, and you need to get this right because there's nothing you can do to really camouflage poor temple points. You know, going back, if the work's not so great, you've got something in front of it, but here that, you know, they're very much at the front now, nicely created. Interestingly, on the temple points we can see that there's no such thing as symmetry in nature, because you can look at this patient's native temple points and he actually documents differences in angles. So here, very fine, came to us for this refining work, take a lot of singles, very fine work here, replicating his native angles, flush to the skin, and this case is documented from coming to us through now to from 2 months, 2.5, 4.5, etc., and then going through. And this just shows you really the importance of consultation, because here you've got month 2 update, under direct light, no fibres, and then you contrast that with fibres and no direct light, you can see a very different seaming head of hair. So when people talk about consultation and photos, this can show you really quite graphically the difference between 2 different photographs, probably taken the same day. So this has been documented going through and up to the 8-month period, where you can see the subtle changes, making big change really in a way. Subtle approach can make a big change often, and we can see these coming very natural, looks very natural coming in, made a nice difference, and the crown really coming in well at 8 months. Thanks for watching, and I hope you can enjoy the photographs in the video. So for upcoming consultations with Dr. Bisanga, they will actually be in London. If you'd like to be seen, then please send us an email at info@bhrclinic.com, and that is with Dr. Bisanga and Dr. Costis, so we hope to see you very soon.